and welcome to today's show brought to you by Servier for the World Diabetes Day. Before digging into today's topic with two wonderful guests, allow me to give you some figures about diabetes. 463 million, that is the number of patients suffering from diabetes as of 2019. This number is expected to increase by 51% by 2045. Also know that 1 in 2 people does not know that they suffer from diabetes before having complications. Today, we will talk about the burden that is diabetes and also how important it is to work hand in hand with the medical team to better manage the disease. Raising awareness and educating about diabetes is a great topic to have today. And with me, I have the honor to receive Professor João Raposo, Medical Director at the Portuguese Diabetes Association. Welcome, Professor, and if you may introduce yourself.
Okay, as you said, I'm the medical director of the Portuguese Diabetes Association, and that's the oldest diabetes association in the world. It was founded in 1926. It is really a patient association with a different model of any other patient association, because we try to have here the outpatient clinic for people living with diabetes, but also a research center, an education facility, and the association promoting the lobbying for people living with diabetes, promoting their rights and duties in the society. I'm also the president of the Portuguese Diabetes Society, so that's the scientific society here in Portugal. And I'm a professor at the Nova Medical School, one of the medical schools here in Lisbon, in the Department of Public Health, trying to show the importance and the relevance of NCDs, non-communicable disease, in public health.
Thank you very much, Professor Raposo. Also with me today, I have Bertrand Renaud, Chief Patient Officer at Servier, a leading pharmaceutical company committed to improving the life of patients suffering from diabetes. A first question to you, Bertrand. How do you think Servier works with patients to allow patient engagement, and how are you committed so strongly to this topic?
Maybe first, I think it is very important to know that Servier is focused on diabetes. It's more than, in fact, 50 years. So we are very committed. In my experience, I used to work, let's say, in Asia, in the Middle East, and I know it is the same all over the world. We have done a lot of things regarding, let's say, detection, screening program, a lot of things with therapeutic education, and we will discuss that, of course, today. We are very committed to diabetes. But for me, what is a bit new is really, I have really a strong belief that if we work with patients, we will achieve a better result, in fact, in terms of control. This is a challenge that we will share also, I think, today. But we have really this strong commitment to work with patients. Yeah.
And we will see throughout the show how much of a difference it makes working with patients. Going back to the patients themselves and diabetes, I will start with you, Professor Raposo. But before that, I just wanted to say that according to the Servier chart, I remind you that we will not be talking about medication and treatment in today's show. Professor Raposo, the first question is for you. We say that diabetes is a huge burden. So my first question is, can you give us some insights into what patients go through, the patient that you talk to and that you see in your daily practice?
Okay, so let's think a little bit about what it's diabetes. First, I think we should differentiate at least between the type 1 and type 2 diabetes. As in type 1 diabetes, usually diagnosed at an early age, like in children or youngsters or young adults, it's a burden not only for the people suffering from diabetes, but also for their families or their carers. And for type 2 diabetes, while we speak that the main burden is for people living with diabetes, but of course it's also for the families. So what's the burden? The burden is that you are diagnosed with something that's for your whole life. It's a chronic condition. We cannot offer the cure for diabetes, which is a terrible thing even for us doctors, not to be able to prescribe a cure. And then you'll have to transmit that for the people living with that condition, with diabetes, saying that, well, you have a long time condition, all for your life, but we can't control it. There are some terrible complications that can arise in the future, but we can try to prevent them, reduce the risk to develop those conditions. And for that, you have to introduce a number of changes in your life. We have to control your food, your nutrition, what you eat. We have to control your physical activity. We have to take decisions almost every minute in your life, controlling your blood glucose levels. And you have to take medication. And imagine that we said that for people, imagine that for type 2 diabetes, which is easier for my example, that are not really feeling anything different from what they think it was their normal state. They have no symptoms at all. They were diagnosed by a blood glucose test. And suddenly we say all that. We introduce a huge shock in the life of people. And then people get their shock, they can go to denial, they can go to angry, become very angry with their life. Why? It's an injustice. And of course it's an injustice. But diseases are not fair, so it just happened to people. And that is felt like really a huge burden. So we cannot promote their engagement in their process if they are at those early phases and we are not offering the right solutions at that stage. So again, diabetes is really a huge burden because not only it affects a number of people, a huge number of people, it has a difficult and complex treatment and monitoring process. It can be related also to diabetes complications, eye, kidney, foot. So everything that is really concerned with our quality of life is implied on the treatment of diabetes. And we seldom try to minimize that, saying that it's an easy process, accept the disease, accept the treatment, and you just can live your normal life. And actually, that's not true.
So, Professor Raposo, one of the first things that you tell your patient is to change their lifestyle, adapt their diet and physical activity. Can you explain to us how diet and physical activity can change what impact it has on the glycemic profile of type 2 diabetes patients?
Mm-hmm. Yeah, well, those are key elements, key pillars on the treatment of type 2 diabetes. But actually, as we can see in most of the guidelines, they are usually at the top of anything with any kind of medical treatment, with pharmacological treatment. But actually, we try to jump to the next step and go straight to the pharmacological treatment because we all know how difficult it is to change lifestyle of people living with diabetes. And we all know that the physical activity can reduce significantly the levels of the blood sugar because it promotes the muscle consumption of glucose. And actually, that's an effect that prolongs in time. So it's not just during the exercise, but actually change your own metabolism, promoting the glucose, the sugar consumption. So it's actually quite beneficial effect to try to increase the level of physical activity. And it's almost the same as with your diet. You can try to change the diet, control the level of your carbohydrates. You can try to reduce your caloric intake. And we all know that those, and now we can see that, and most of the people can see when they control their blood glucose, they can see which kind of foods promote either a glucose spike or a normal glucose level. And for that, it's quite obvious for people seeing the effect of the nutrition in their treatment. But again, imagine that, Anka, you can imagine also that, or any of you listening to me, imagine after 40 years of your life, having your normal eating pattern, having your normal physical activity pattern, not feeling particularly ill, and then a doctor say to you that you have to change that. How can we do that? Even if you are, if you have all the reasoning, all the scientific data, we all know the benefits, but we don't change just by thinking that we should change. Most of us change by emotion. And that's the $1 million question is, how can we promote that emotion, that movement for people changing because they want to change?
Well, building on that, how important do you think that active patient engagement in disease management is to have these positive outcomes that you're talking about?
Again, that's the starting point. And I think even Bertrand knows that, and that's why the company is promoting that also. But everywhere, if we don't have the team involved in this patient engagement, that was called by the World Health Organization many years ago as therapeutic patient education. That's something that we here at the association try to promote for the last 95 years, because as we have said, if we don't do that at an early stage, if we not try to raise the motivation level of the people to promote those changes, we can offer the best therapies, the best technology, the best pharmacological treatment, the best nutritional advice, the best physical activity, even with a personal trainer or whatever you want to include in the team. But then we are doomed to fail. And that's why, up to this moment, it's when we see the results on diabetes, it's less than 15% of the people achieving all the targets for controlling diabetes, meaning like A1C, lipids, blood pressure, physical activity levels, diet. So it's actually it's a very low level of acceptance of these guidelines. Why? Well, because we don't promote that patient engagement. We are not doing the first step, that's discussing with the patient what's their starting point, what are they aiming to, and work on that. We are so keen to explain them all about diabetes, all about the glucose levels, all about the effect of insulin, the effects of glucose uptake by the muscle, everything so scientific, everything so evidence-based, that we are forgetting that, again, people don't do that, they don't change based on that on that scientific reasoning. We change based on motivation, and the teams, we all should be experts on dealing with those motivational tools, with educational tools, promoting that. We shouldn't go beyond that if we don't work on that.
Building on what you're saying, patient engagement also comes with an evolution in the doctor-patient relationship, which is moving towards a partnership. I'm curious, how do you see that happening in your practice, and how do you develop this shared decision-making process?
Yeah, it's really an evolving situation. If you can go back on time, for the last 30 years or something, the patient-doctor relation was mainly unidirectional. So it just went from the doctors telling the patient what they should do in their daily life with their food, physical activity, with drugs, and patients usually accepted that prescription based on the role of the doctor in the society, and because they were not supposed to contest and not saying that they were accepting everything from the doctor. And luckily, even if there was not such a huge success for that model before, but during a consultation, it was more calm, you can say that, because again, it was just doctors telling the patient what they should do. Nowadays, due to evolving rules of people in the society, that's not the case anymore. And now we can really promote the patient engagement in that process of the consultation. And we have to know that it's not just giving information, because now the patients, the people living with diabetes, they have access to much more information on the internet, on the social media, and now we have to be challenge that information, giving their educational tools that at least at the same level as the other kind of information they have access in the community. And we should be able to promote that discussion during the consultation. It's much more effective if I provide the space, the time for people living with diabetes, telling me I've read on a paper, I've read on the internet that information, and with my computer in the consultation, I can go immediately to that point, to that information, and discuss it. And as that, we are really working in a partnership with the patient, promoting that discussion. And so I'm starting from their knowledge to a new knowledge that is a shared knowledge between both of us. And that's clearly much more effective than just me saying anything, when I know that nowadays most people living with diabetes have access to much more information, to any kind of technology. And I really should know, start my consultation always asking what they want to discuss at that moment, what have they been reading, what they have knowledge, and then starting from there, and going to this new level of knowledge, shared decision. That's the most important thing for success.
So, precisely with the objective of spreading reliable information here, I have a couple of questions about the daily life of patients suffering from diabetes. Very pragmatic question. The first one is, how often do you recommend your patients to follow up with their healthcare providers?
Well, in diabetes, as in other condition, we don't have a one-size-fits-all solution. Even when we try to have those guidelines saying at least every 3 months or every 4 months, it really depends how control people are, how the kind of access they have to healthcare professionals. It's also very, very relevant. And we know this in this World Diabetes Day, we are speaking also about access to care, to diabetes care. But so it's something between the every 3 months to once a year, if that's also possible. But for some of the patients, or some of the people living with diabetes, we have to recommend even a short contact, and for that, we also have to discuss the introduction of the teleconsultation, of remote access to people, because it enables us to be in a close vicinity with people living with diabetes. And sometimes that's useful for people starting their process with their condition, if you are changing the treatment, and for those kind of situations, we have to promote a shorter frequency of contact.
You were talking about teleconsultation, so that would lead me to the COVID pandemic, as we are hopefully reaching the end of it. Do you have any specific advice for patients suffering from diabetes in this particular moment in time?
Well, hopefully we are checking almost to the end of the pandemic. That would be very good, and I really hope for that. But I think, and we try also to demonstrate the relevance of the patient engagement to governments, when we show that people living with diabetes, probably they were the best candidates to stay at home, to be in touch with their healthcare teams, because they were able to manage their condition without going physically to the consultations. And it was possible to show that it was possible to have the teleconsultation, even by a normal phone call, nothing so as the video consultation that was not accessible for most of the people. But it was possible to share information. It was possible to do structured consultations, because the people living with diabetes, they know what they should say to the healthcare team. They should say if they have gained weight, how is their blood pressure, how are their glycemic levels, how is their health doing in any other condition. And so it's quite important to promote that patient engagement, not only for diabetes, as this is the case, fortunately, for many of the people living with diabetes in some parts of the world. But we should promote that knowledge that comes from diabetes to the chronic conditions. And I think that's also the challenge for the World Health Organization, for the governments, for the carers, to learn from diabetes and promote that kind of engagement to other conditions.
Professor Raposo, we are talking about diabetes follow-up, but at what age should we first go see a healthcare provider, and what are the symptoms that we should be looking for if we suspect diabetes?
Well, we are speaking mainly about type 2 diabetes, and as I said before, type 2 diabetes is mainly asymptomatic. So people don't complain of anything or anything as they consider relevant. And because of that, we should promote the screening of diabetes. And for that, we have to consider at least two groups in the general population. One, we can consider the high-risk population. So those are the people that have relatives with type 2 diabetes, people that are overweight or obese, people with high blood pressure, with dyslipidemia, the women that had previous diabetes during their pregnancy. All those are at high risk of diabetes, and they should be living and they should be going to screening at an early age, after 30, 35 years old. For all the other people that don't belong to that high risk group, they should have their screening starting at least at 40. But in many guidelines now, we try to introduce those recommendations at 35. Why? Because it's also important to create awareness for diabetes. And at least, even if they are considered at a low risk of developing diabetes, we should advise them how important it is to keep their weight, how important it is to keep their healthy lifestyle, or change to a more healthier lifestyle. And so those are the recommendations. Because when people start to have symptoms like becoming tired or their thirst, drinking a lot of water, urinating more, usually that reflects a more decompensating diabetes, which means that we are diagnosing in a very late stage. Those are usually the symptoms of type 1 diabetes.
Thank you, Professor Raposo. Bertrand, I'm turning to you now. At Servier, as a leading pharmaceutical company, you have developed many efforts to work with diabetic patients and to promote patient engagement. Can you give us some examples of your initiatives?
Yeah, maybe first I'd like to say that I really enjoy when Professor Raposo spoke of this team, you know, doctor, nurse, family, patients. Of course, this is essential in the result. And I think we as pharma, we have, of course, a role to play. We work at, in fact, different stages. Maybe before the consultation, I think our duty is really to help the patient to prepare the consultation. But to help the patient means to work with the patient to see what are the challenge for him and what will be the key question. So we have produced some, let's say, educational tools with patients with their question. How should I prepare my consultation? What could be the key symptoms that I have to discuss with my doctors? So this is before. During is, of course, to have an interactive discussion, something which is relevant for the patient. And then after, maybe to be able to go back at home and to say, this is what they asked, to be able to say what happened during the consultation, to make a kind of recap to their family. If they can make it, it is really a hint that we are on the good way. And those things are done with patients. We cannot invent them, you know, from the pharma side. So clearly, I think this is when we work with them that we can produce something which is really helpful. I know that the team is also working on a kind of platform, My Health Partner, with a lot of advice. But those advice are really relevant only if they are co-built with patients. And this is the case. This is done with patients, with association, Global Heart Hub, to help us to make something really useful. And I think this is key for us.
This is indeed very important. And at Servier, you also worked in a team with Professor Raposo on a study that was called Unmet Needs for Type 2 Diabetic Patients. That was the basis for your campaign that was called Act Now for Diabetes, and that is still ongoing. Can you tell us what are some of the main findings in this study?
Oh yeah, I think this study, and thank you, Professor Raposo, also, because he was really part of this team with patients also. First, maybe the methodology for us was very new. That was both, let's say, qualitative, with discussion with patients to see what could be the main outcome that we are looking forward. So this is one. Second, the panel was rather new for us, with, in fact, a huge panel, more than 300 patients from different countries, China, Russia, Brazil. So this is something new. And the finding also, this is, I think, on the ad here. This is not our campaign. This is a campaign which is really done with patients. And what they say is that those symptoms, drowsiness or fatigue, or this feeling of being very often with very thirsty, that kind of things, or blurred vision, those symptoms, in fact, for them, should ring the bell. This is really the key lesson, I think, also for the publication. Really, it should ring the bell, and we should be aware of those symptoms, which, in fact, were not that much in the radar before. So this is one. And second, they say in this publication, in this paper, the patient, they say what they need. So they need support, and they need to be part of those supports. This is what we try to do now. Yeah.
That's very interesting. And before concluding, do you have any other examples of projects that you would like to share with the community that you're working on at Servier?
Oh, yes. In fact, our ambition is to work with patients at all stages of drugs life cycle. So during research, and for instance, in diabetes, in clinical research, we really work on what we call real-world evidence. Real-world evidence, it's those data which are really reflecting what happened in the real life. You've seen during the COVID period, the importance of those data, real life. So those data are even more relevant if they are co-created with patients. So this is something very important for us, and our ambition is really to look for those data, to publish those data with patients. So this is an example. Maybe another example is adherence. I think Professor Raposo was very clear. The rate of uncontrolled patient in diabetes is huge for several reasons. I think he was very clear in the way to say how much it's multifactorial. It's a big change in lifestyle, etc. And clearly we have to work together as a team, with doctor, with patient, with nurse and family, to improve this rate of adherence. And every percentage we will gain, it's a major, in fact, a step for the patients. So this is something for us which will be very important. For diabetes, in fact, for chronic disease, as it was said also, diabetes doesn't stand alone. You have, of course, a lot of disease combined with diabetes, cardiovascular disease, and other metabolic disease. And really, I think we have to work together on those diseases to increase this adherence rate. And of course, the engagement of the patient will be key in that.
Thank you very much, Bertrand. And turning to you, Professor Raposo, for the last question to conclude, we've been talking today about patient engagement in diabetes. Can you give us an example of a patient that has particularly touched you, or that perhaps has even changed your practice because they were precisely very involved in their care?
So that's also a good question and a challenging one. I can try to tell you a real life patient, people living with diabetes. So it's a 52 years old man that was coming to the association, coming from the primary care. So most of the people with type 2 diabetes are followed here in Portugal at primary care level, and that's quite good and normal. But he was sent to us, referred to us, because of a very bad compensation. He was obese and a high level of A1C, so very decompensated. And we tried everything here, even we try our motivational strategies here, but he never started to eat properly. He never started to have more physical activity, even if he was engaged or supposedly engaged. And then he decided, and it was quite his suggestion, to go to surgery because to try to decrease his obesity level. And we said to him, well, if that's your solution, let's move to that. And he returned to our clinic 1 year after, much more thinner, so he lost a lot of weight. Diabetes was almost perfect. And we asked him how was the surgery. And the surprise came then when he said, no, I didn't have any kind of surgery. So what happened to you? Well, my son told me that he was going to have a baby in the family. So it was my first grandchild. And suddenly I realized that I wanted to see my grandchild grow. And I wanted him to see his grandfather as a healthy person. And so I think with that example, and again, it's a real example, I can try to show you how important it is to find the right motivation, how important it is to work with people living with diabetes, because if it was not that, we would evolve to more therapies and giving up on him. And actually, he had his inner energy to change. He was able to change based on all the information that was provided to him at an earlier stage. But actually, just as healthcare providers alone, we were not able to succeed. So again, I think with that message, I think we can say in a very positive way that people living with diabetes are the key elements in diabetes management. And so we should work always with him, with the patients, and as that, we are aiming for success.
What a beautiful story to end this show. Thank you very much, Professor Raposo, for your participation. Thank you, Bertrand, Renaud, as well. Thank you all for watching this show. If you seek information about diabetes, know that Servier launched a global awareness campaign that is called Act Now for Diabetes, and that is still going on. Feel free to share this video and continue to spread awareness about diabetes. We'll see you very soon.